Hello and welcome to chapter 4 stroke part 4 of our spinal rehab program. So we've discussed so many things in parts 1, 2 and 3. Now we're actually getting down to the things that you should not do. So what I have found is over the years that there are so many practices that have been used for lower back pain, and some of them simply do not stack up to science. They simply are to be avoided. Now, before we go any further on this, I think it is very important to say that a lot of what I'm about to say depends on your personal circumstances. So they're principles, and then there are certain areas that you can bend and tweak depending on what you want to be. So perhaps you're just a normal person who wants to get back to sitting at a desk without back pain. Perhaps you're an Olympic lifter. Perhaps you're a belly dancer. And each of those things require different aspects of conditioning, if you like. So we need to be a little bit careful in saying absolutes. So one I hear a lot. So person comes in to see me, they've had a history of lower back pain, they've been to see the doctor or another practitioner, and that practitioner gives them a blanket statement of, well, you need to go and do yoga or more recently Pilates. And the question is that good or bad for my back? So, well, the answer is, of course, it depends. In some cases, yes. In many cases, no. And what it comes down to is, has that person had a proper assessment, and then what is the appropriate prescription of exercise therapy? So, for example, if you have a discogenic based problem, that problem, so the MRI scan might look the same from one person to the next, but it might be that that person's problem has been caused by flexion intolerance, extension intolerance, lateral shear, AP shear, and the list goes on. And it could be a combination of all of those things. So giving out one prescription for somebody is inappropriate. So what often happens is that people go to yoga and they get this lovely pain-killing stretch reflex, but they might have terrible instability in one segment in their back. And so in the long term, it is actually quite costly to them. So I've cited an example here, and once upon a time I was Pilates trained, and so I can say this with some level of skepticism about my own previous practice. But the roll up and roll down as in a Pilates exercise, if you have back pain, it is going to make you worse. So it is something to be avoided. The science is very clear on that, and it is something that if you have an active disc problem, the roll down is to be avoided. So that's one example. Continuing this theme. So as we've said, it's not good as a general prescription. Each person must be evaluated on their own merits, and there is no one exercise program for back pained people. It needs to be specific. And then speaking about specifics, let's talk briefly about this Pilates concept of imprinting your spine. So you can see in the picture there the person doing an exercise and their back is flat against the floor. And in the old days in Pilates, people were very much encouraged to push their back firmly into the floor. And the truth of the matter is that for some people, a little bit of excessive lordosis is normal. And that's just the way they are. Therefore, ramming the spine into the floor and holding it there no matter what may not be appropriate. In actual fact, it may be appropriate that they have a little bit of space under there. So again, it's for everybody. Repeated spinal flexion, period, full stop, with a discogenic back problem is dangerous. So you need to be very careful. Now, on the other hand, to play devil's advocate here, it might be that if you are a person with back pain and you are rigid everywhere from top to bottom, yoga might be just the prescription for you. And I think, what we need to do is go back to what is your specific issue and what is your problems and how do we work from it. Now, next slide. We've been talking about stretching quite a lot. And we've been talking about this stretch reflex quite a lot, and how If you have an unstable spine segment, then stretching it would be a problem because you're ultimately going to be making it worse. So what I want to draw your attention to here is the picture at the top with the leg and the cutout section of the spine. Now, a stretch reflex, what it does is it sends a signal to your central nervous system, and then your central nervous system creates a classic reflex hammer response there back again. Now, why it is pain killing is it's to do with the pain gating theory, which suggests that when an input goes up to the central nervous system, the pain to the gate, if you like, the gate will only allow one sensation through at a time. And if you have a stretch reflex, that will temporarily block out the pain signals. In the same way that if you stick a hot water bottle on, it's soothing. The heat sensation will temporarily block out a pain sensation. So we are getting some kind of neurological phenomenon that reduces pain, but the mechanical aspect has not changed, except you may have made a segment that's already loose. You may have made the ligaments even slacker. So instead, what we want to do, if you look at this pictures below, we want to keep our spine in neutral, and then we want to add stability in that scenario. Okay, here comes the bits that hopefully are going to start to cause some drama in what you're doing for exercise therapy. So sit-ups, repeated sit-ups or loaded flexion, as previously stated, tolerate the normal load that is described for your discs in a laboratory setting. And as a result of that research, many Western military forces who formerly had a 1-minute sit-up test in their fitness tests have been forced to take them out because they get young people come in who wish to train to be in the military, and over their training to get through the tests, they give them a disc problem. And that has been recognized by most Western forces and now is replaced with a plank or a side plank test instead. So sit-ups are a big no-no. Pulling your knees up to your chest or doing a roll back as shown in the pictures. How many times have people like me who've been trained in whatever form of manual therapy applied that to someone? And all that is actually doing is causing lumbar flexion from the pelvis side. So you are anteriorly rotating the pelvis, which is taking S1, L5, maybe L4 into lumbar flexion, pushing disc material posteriorly. It could also be stretching those very, very important lumbar sacral ligaments. So again, that is something that we don't often do. And next, here comes the big one. So I can't tell you how many thousands, probably tens of thousands of times in my 25-year career we've given the lumbar roll. And again, what research now shows is that rotation or twisting is one of the most damaging movements to a already impaired disc. So very rarely, if ever now, do I give out a lumbar roll. Yes, you will get a nice stretch reflex, but it will cost you there afterwards. I see this one all day long in the gym, the Superman. So this results in 6,000 newtons of compression in a hyperextended spine. That is nearly double the amount of newtons that a normal disc will tolerate. And yet we still see personal trainers doing it on a regular basis. This is totally contradicted to basically recovering from, in the short term, for a discogenic back pain. So many people have been encouraged for years and years and years to do a stretching program. It has been shown that the greater the mobility and flexibility of the spine, the higher the future risk of back pain is. I'm going to talk around this in a second, but one thing that we can see here is that if you are going to be a heavy lifter, then extreme flexibility in the spine is going to compromise that ability. Now, when it comes to stretching, we do advocate it in circumstances. So we thoroughly advocate stretching the hips because we don't want leakage of movement from the hips into the lower back. Likewise with the shoulders. So we encourage flexibility and stretching in the limbs, but stability in the spine. So I wish to just take things back a little bit and recap for a second. So if you go back 50, 60 years, we had many people starting to research into what's going on with back pain. People would come in and they'd say, I've got these spasms in my back, it feels very tight. And researchers would do the best at their time based on the science. And the common sense thing was, well, you've got this tightness, you've got this spasm, so we'll stretch it to remove it. But what people didn't understand is about how the nervous system works. So these people had disc problems. And when you have a disc problem, you immediately get instability, you get micro movements. And the central nervous system goes, that's not good for you. I've got my spinal cord and other valuable tissues running through here. I don't want micro movements. You're damaging me. So in its wisdom, what it does is it throws in a series of spasms. It goes, I'll stop you. You won't be doing that in the short term until it's calmed down. So it throws in multiple spasms which stop you from moving that segment. And those spasms, they feel tight and they hurt. So it was logical at the time for researchers to go, well, what we'll do is we'll stretch it out. And yes, you stretch out the spasm and you get temporary relief. But then soon afterwards, the spasms come back again because the central nervous system is still trying to protect that segment. And that is one of the reasons why in the long term, we do not encourage stretching of a spinal joint in that way. Posture always matters. So research has shown that if you take a lady and she sits at a desk with poor posture, provided that she's had no previous back pathology, after 30 minutes, it causes plastic deformation of the soft tissues of the spine. It then takes, once she has stood up, 40 minutes for that plastic deformation to recover. In men, it takes a fraction longer. So this has huge implications if you've got somebody who works all day long at a desk and then wants to go to the gym at their lunchtime. They are probably still in the plastic deformation phase, and if they go deadlifting in their lunchtime, they run an increased risk of hurting themselves. So posture always matters. Lifting with poor posture. So there's absolutely no doubt here that if you lift like that person in the bottom picture, if you lift like that with poor posture, you are going to hurt yourself. It's as simple as that. What we are attempting to do is to keep the edges of the vertebrae, like in the next picture, parallel. What we don't want, and you can't actually see this very well in the other picture, is we don't want those edges to start squeezing and pushing disc material backwards. So when we're lifting, if you look at the top picture, we want to lift by pushing our hips backwards in a hip hinge. We want to keep our back flat, and then we want to push our hips forward whilst driving the earth away through the midfoot. And that is how we effectively lift with good posture. Hopefully that's all helpful, and we can start then looking at how do we train to recover from back pain.